Hi, everybody. Karen Roby here for ZDNet and Tech Republic. You know, the AHA, of course, the American Hospital Association, estimates that hospitals have lost more than $200 billion because of the COVID-19 pandemic. And hospital leaders always looking for ways to get patients back into the doctor's offices and the hospitals in a safe and secure way. I'm happy today to be joined by Jay Rosehart. He's the president with Illinois-based Memorial Health Centers, Systems Ambulatory Group. That's a mouthful, Jay. Thanks for being with me here today.
You're welcome. I'm glad to be here.
Absolutely. You know, as I just mentioned, looking for ways to keep patients safe so they'll feel comfortable to come back into their doctor's offices and the hospitals. Before we get into the technology, how this is helping you guys, talk a little bit just to start us off here about the population that you serve there in Illinois.
Sure. So we're in Central Illinois, in Springfield, Illinois, to be precise. We're serving around 500,000 to 1 million people across 9 to 27 counties, depending on if you're looking at our primary or secondary service areas. We do that with 5 hospitals as well as a physician services group. We've got well over 200 providers. It's physicians and advanced practice providers now, as well as a home health organization, home hospice, durable medical equipment, behavioral health, et cetera. So we're a large integrated system, about $1.4 billion in revenue when we don't have a COVID year.
Yeah, it's been a challenging year, right, to say the least.
It has. We, the very first month of the pandemic, we saw our volumes decline about 40%. We actually saw about $100 million loss in 1 month, which is a larger loss than we've ever had in our history. And primarily that is due to having to shut down things like clinics, having to shut down some of our more elective procedures, and figure out the processes that we needed to keep people safe, so that they can still get the care they need, but in a safe way.
And on that note, Jay, obviously looking to technology here to help you guys out. Talk a little bit about the AI-based program, how that's helping you all achieve just that.
Yeah, so we're actually back to about 100% of our pre-COVID volumes in our ambulatory areas. That's our physician clinics primarily. We do about 300,000 of those a year. And the way we've gotten back is by making it as safe as possible. And one of the things we're doing is rolling out a chat bot to actually be the virtual waiting room. The good silver lining this pandemic is it's forced hospitals, health systems, physician practices to innovate and to try to think a little bit more consumer friendly and a little bit more technology forward. We've always been technology forward on the direct care giving side, but this is more on some of the other things. You ever go to a physician office and you have to fill out 15 forms and think about all of the waste that is being consumed during that period of time that you are checking in, scheduling an appointment, giving them your insurance card. Somebody is entering that manually into a system. Somebody is then billing for it. Somebody is then coding for it. Somebody is then adjudicating that claim on the insurance side. There is all kinds of waste and all kinds of manual process that really is not related to actually a physician giving you care. So we're using AI to try and automate that. We're using a chat bot to try and automate as much of that manual process as we can.
So yeah, if there's one thing that the pandemic has certainly taught companies and school systems and health systems is where they're lacking when it comes to technology, and so many have moved really down the line with digital transformation, whereas others are way behind and having to pick back up. So talk a little bit about, for a patient now, what they see when they're interacting now. What is the message that's being sent is now you can come in safely to the hospital or to the doctor's office. What does that look like for the patient?
Yeah, so to keep people safe, what we're doing is we're doing as much as we can outside the physical 4 walls of the hospital, whether that is telehealth visits through a platform like Zoom that we're on right now, or whether that's through in-person visits, but moving as much outside of the 4 walls of the clinic or the hospital as possible. So right now what a patient would experience is they would actually get a text message saying, hey, you've got an upcoming appointment. Click on this link. It would confirm who they are, and they would actually go through their phone, their cell phone device, to actually complete all of that paperwork that they would normally complete sitting in the waiting room, to do all of the registration, all of the check-in, to get the information on their insurance. It would also give them reminders about the day of, in terms of, hey, your doctor's running a little bit ahead of time. If you can be here early, great. Or, hey, your doctor might be running a little bit late. If you want to push back your arrival time by 5 minutes, that's fine. And essentially, all the way to the point where as soon as the patient's ready to be seen, they can walk straight into the office, bypass the waiting room, go straight to the doctor and be seen by the doctor. That's the goal of this.
And how do you see long-term that things have changed or will change as a result of the last, call it 6 months?
Yeah, I think long-term, the first of all, the social and financial implications of COVID-19 are going to be long-lasting. They really are. From a financial perspective, hospitals, health systems everywhere are going to be looking for ways in which they can reduce cost, improve efficiencies, and attract and keep patients loyal to their health systems, and loyal to their physician practices, and loyal to their primary care panels. And one of the ways they're going to have to do that is be more consumer focused, and a little bit more in touch with what a consumer and an individual who is seeking healthcare in the local community wants. In our local community, one of the things that we know they want is a little bit more technology, but they still want that personal touch. One thing that our solution has done, in partnership with LifeLink, the company that's helping us develop the chatbot and the AI solution, is ensure that personal touch. They use a term called person in the loop AI, which means if the AI or the chatbot ever gets to that point where it doesn't understand something, you can link up to a real person. You can really get up to that real person who can intervene in the real time to assist that individual and still have that personal touch and still have that personal interaction. For our patients, that's really important. It's really important that they feel that local face. And it's also really important from our safety standpoint that we can continue to deliver the care we want to deliver and the care patients need, but in a way that does not jeopardize their safety during a pandemic when we should be social distancing and we should be masking and keeping people out of waiting rooms, etc.
Yeah, most definitely. And Jay, in closing, obviously no one could anticipate where we would be right now if, you asked in February, where we'd be in August or 1st of September here. But do you feel like you guys have moved through the most difficult part of it now? Things are coming together and the technology is starting to work, to the benefit of your patients. Do you feel like you've made it through or over those speed bumps, per se?
Yeah, I sure hope so. But hope's not a strategy. So we are continually developing strategies to ensure if we do have any more speed bumps or if we do see the positivity rate grow, that we know what we're going to do next. I will say we're in a much better position now than we were back in March, when this was really developing and starting to heat up. And that's despite our positivity rate being a lot higher than it was back in March, not only nationally, but here locally. So to me, that's a testament to some of the work that we've done, and it speaks to our ability to really adapt much more quickly in the future. And that adaptation is going to have to continue to come, because regardless of what happens with the positivity rate, I think the financial and social implications that have occurred are going to force that adaptation even quicker.
Yeah, no doubt. We've all had to adapt and change and be patient, and
Yes.
have been tested on many levels, Jay. But I certainly appreciate you being with us and sharing with us here today. And we wish you guys the best as you continue to work through this.
Thank you very much. Appreciate being here as well.
Absolutely. All right. Well, you guys, for much more on artificial intelligence, what you need to know, make sure you check out Tech Republic and ZDNet. And thank you for watching us here today.